A group of people is only a group of people unless they have a common goal. And it's the common goal that changes a group of people into a team.
Recently, I shared with you the concept of building our base. BASE stands for the strategic priorities of belonging, access, safety and quality, and experience. Today, I want to introduce you to the 6 key enterprise initiatives behind those priorities, which will help us build our base.
To support belonging and inclusion, we will devote resources to diversity and anti-racism training across the organization. For access, our Care at Home program will help us bring patients home earlier and increase capacity for others who need care.
For safety and quality, we must improve our sepsis outcomes and reduce mortality. For experience, working together to improve our communications with patients will impact both the patient and employee experience. In addition, we will expand our strategic growth and partnerships by focusing on our revenue management and segment-specific growth plans.
I recognize we have a lot of work ahead of us, but if the last 18 months has taught us anything, it's that when we work together, we can develop new, forward-thinking innovations in patient care. I know we can continue this momentum with our commitment to continuous improvement. And while all these initiatives are important, we chose one, Care at Home, as our initiative of the year. The Care at Home concept is simple. We find pathways and programs that allow us to send patients home earlier and complete their hospital-level care at home. I believe we can all support Care at Home, regardless of where you work in the organization. This initiative has many benefits for patients, aligns with our core values, and supports our mission to advance health for Michigan and the world.
So I think the Care at Home initiative, being the strategic priority for the year, will bring a level of awareness across the entire institution. This is pretty cutting edge, and so we need everybody to be thinking innovatively about whether it's direct patient care or care management needs or financial needs. It's all hands on deck.
For us as a department, it's going to be how we can help our faculty identify some of these patients who would be candidates for Care at Home.
We do have some patients who come in quite a bit for fluid overload, or it's lab draws, it's medications, it's things that they could do at home with close monitoring. Maybe we could avoid those admissions and really keep them at home, which is where they want to be.
It's required a lot of creativity, thinking outside the box, if you will, to ensure that we're delivering a seamless product to our patients.
We need to shift our mindset that we can do this outside the 4 walls of the hospital, and we can actually do it in the comfort of the patient's home. That's a huge change in how people think. Most people think, well, there's no way that you can get this type of treatment at home, but in reality, we can do that.
As with any new initiative, I think you go into it with open-mindedness, willingness to learn. As we say, leaders invest in the Michigan difference, and hopefully these are the types of differences that we can make and be leaders in.
No matter what your role is here at Michigan Medicine, you can support Care at Home and make a difference. Please join us in our goal of reaching an average daily census of 10 patients per day by next June. Together as a team and with your support, we can reach our goal.